imagine that someone with a sister who is blind who is going to say, okay, let's give $40,000 to a dog, and someone else who doesn't have that sister who is blind will say, okay, give the money to the other cause.
Yeah, you're right. It's impossible to eliminate bias altogether, but striving by being driven by certain values like impartiality and rationality, you can overcome some biases. So they try to strive to overcome as many biases as possible, but eliminating them altogether is impossible. I agree. Certainly, if you know someone who is blind, or if you know someone who has cancer, you would, of course, be more willing to donate to the Cancer Fund than to Against Malaria Foundation, for example, which is only logical. But they are just saying that, given the choice between different charitable organizations, and if you are able to overcome your own intuitions and biases, they recommend you to give your money to the most cost-effective charities, because then your social impact will be much higher than when you donate to a charity that's not effective at all. So that's the basic principle, actually, I would say. I hope that answers your question.
Yeah, it's a good principle.
All right.
Oh, Joeri, can you start?
Yeah, sure. All right.
Your first charity against Malaria Foundation.
All right. So the first. Right. All right. So I already showed a few charities that are recommended according to scientific research of Give Well, Giving What We Can, amongst others, which is the Against Malaria Foundation. So in this presentation, I will try to show you and convince you in 8 minutes why this is a good organization to donate your money to. So I will show you what they do, how they do it, and I will try to prove their effectiveness by using proof of the Against Malaria Foundation itself and from GiveWell. Right, so first things first, why should we fight malaria? I don't know if any of you are familiar with the disease. I think no one from personal experience, or else you will have had a lot of bad luck. But malaria is, I think most of you will know, but I will say it here anyway. Malaria is a disease which is caused by a parasite which is carried by mosquitoes in tropical countries. And malaria is a very big problem, very substantial problem in sub-Saharan Africa, where 500,000 people die each year from a bite from a malaria-carrying mosquito, and 70% of them are children under 5, which is very tragical, because people in poor countries then tend to have more children, and then if they get infected again, they could die again, and it creates a perpetual circle of death, you could say. And 400 million more people fall ill due to malaria, which has very negative side effects on the economy of those countries, school attendance of children, and so on. And it's also the #1 killer of pregnant women in sub-Saharan Africa. So, what can you do to prevent malaria? Although we do have medicines for this in the West, they are too expensive for people in Africa. So the cheapest way to prevent malaria in those countries is by providing bed nets, which protects people simply from getting bitten by a mosquito. And the Anti-Malaria Foundation funds these bed nets for $2.50 a piece, and 100% of the money you donate to them actually goes to these nets, to these long-lasting insecticide nets. It are nets that are sprayed with insecticides, so that when a mosquito lands on the net, it will die, which also reduces malaria population, which is a very important side effect, and also protects people, of course, who are not sleeping under a net. So they also have very effective ways of ensuring that the nets are really put above the heads of all these people, and their distribution partners, with which they have built up trust and a very narrow cooperation, make sure that these bed nets are actually distributed, and these sister organizations also pay all the education and distribution costs of these nets. So what do they do? First of all, they do a pre-distribution survey with one of their partners, which consists of a questionnaire of 22 questions, which helps the Against Malaria Foundation to assess the necessity of distributing bed nets in a certain area. And this looks a lot like the way effective altruists think, because they also want to make sure that they make a very big difference for a large amount of people. And if you want to do that, you have to look at which areas are most malaria-ridden. When they choose to distribute afterwards, they will control the distribution by asking the partner organizations and local villages where the nets are distributed to provide them with film footage and pictures of the distribution, the education of hanging malaria nets, etc. And the distribution is also surveyed very professionally and reported. And every 6 months they will do this post-net distribution survey. And they do this to check the condition of the nets, the usage of the nets, and then they also, and 5% of them will be randomly visited to really check for use, and they do this in a 3-year cycle. The nets last for 4 or 5 years, and the usage of the nets is controlled for 3 years. Then they do a lot of other things as well to assess if their work has been done effectively. Namely, they check the malaria rates in the locations where they distributed the nets, and they compare that with malaria rates where nets were not distributed. And this is part of the of national malaria control programs, and they use really substantial data to really check if malaria rates went down, and if, for example, child mortality went down. They strive for what they call universal coverage by breaking transmission, and and they do this by spraying the nets with insecticides, like I already said, to reduce not only the malaria cases but also the number of malaria mosquitoes. So they also try to reduce the population. All their data is published on the website. All the pictures, film footage, is published, and also all the donations. And like I said, they also compare the situation with 12 months pre-distribution to see if the distribution really had an effect. Well, like I said, GiveWell, which, to repeat, because I have 1.5 minutes left, they compare thousands of different charities, and they have been recommending the Against Malaria Foundation for a few years now, due to the following facts. According to their research, the Anti-Malaria Foundation has very strong evidence for reduced child mortality, so less children that die from the results of malaria. They have a very high level of transparency, and they have excellent documentation and reporting on their net distribution, and they are very cost effective, because a bed net only costs $2 to $3, according to the estimates of GiveWell, sometimes a little bit more expensive, and one bed net protects 2 to 3 people, and then mainly children, because children under 5, because they don't have a very strong immune system and are more likely to die as a result of malaria infection. Well, I'm also very supportive to my colleagues here, so I will also tell you a few downsides of the Anti-Malaria Foundation. One of them is that the malaria mosquitoes are getting resistant to the insecticides, but the Anti-Malaria Foundation and also malaria experts are looking at this, at solving of this problem. And GiveWell only found excellent documentation on and reporting on one very big net distribution, so they are wondering if all their very big net distributions will be as effective as the one they documented. But besides that, all the smaller distributions have been very effective, and they actually used a lot of evidence that the Anti-Malaria Foundation uses itself, which, knowing GiveWell, is not a sign of laziness, but it's a sign that they really agree with the effectiveness that the Anti-Malaria Foundation documents. So, all right.